Hi, it's Dr. Sandy Cremers, one of the surgeons at Visionary Eye Doctors. Thank you again for joining us for the EYE show. This is your show. I hope you guys are enjoying this and continue to send us suggestions and questions that you have for us, because we're happy to help you understand what we can do to help you with your symptoms of your eyes. And so this is episode 29. Please pass this on. Please subscribe. Please join me every week for these episodes and pass them on. As you know, many times I recommend to patients to close their eyes when they look at me or look at my videos, because technically I'm not eye-worthy if I'm not really showing you anything you really need to see. So please close your eyes as you listen to me when you can. If you're driving, obviously safely blink. And if you're just cleaning, washing dishes or something, please close your eyes as you listen to this. Part of this video, we are going to show you part of it on YouTube, which will show you what intense pulse light can do for a stye. And I want to kind of visually show you how effective intense pulse light can be. We've talked in previous podcasts about intense pulse light. It's one of the 4 ways we can help dry eye. The key 4 ways are always the same. Warm compresses with blinking, number 1. Number 2, LipiFlow, which is the oldest FDA approved procedure to slow down the gland loss of the meibomian glands, which are these hidden structures in the eyelids. Many of you have heard this many times, but just to show any new viewer, these hidden structures of the eyelid are usually visualized in technology now as these white lines that look like piano keys that are filled with oil. And usually we're born with 30 to 40 of these glands on the eyelids. And as we get older, everything dries up, especially these glands. And we can show that happen now with this technology called meibography. The stye, when you get a stye, it is basically the orifice of the oil glands gotten clogged with either debris, Demodex mites, bacteria, makeup, lack of blinking causes it to stagnate. And just as when you don't milk a cow, the cow will dry up. If you don't blink enough or something kind of clogs the orifice of the udder or whatever it is, the cows will dry up, right? So the idea is the same idea. So the gland, you can literally see a stye starting to dry up and destroy the gland completely. So when somebody has a stye, it's really a race against time to save that gland. It's not a big deal when you have all your, 20 to 30 or 40 glands present. But if you only have a few remaining, then it is really urgent, and we want to get to those patients right away. So for the last many years now, we've been using intense pulse light to help open up styes. What we have found is that time is the most important thing. If we can get to a stye right away, there's less scar tissue that forms at the orifice, and there's less scar tissue that forms in the whole gland. So we want to get right to those patients right away. So what do you do if you get a stye or a little bump on your eyelid that you think is a stye? The first thing you do is get a hot pot of water. This is what I do. I get a hot pot of water. I take my finger. I'm not going to burn myself, so not that hot, but I put my finger, clean finger in, put it right over the bump. I do this 100 to 1,000 times a day. When it gets cold, I dip it back in, massaging, trying to prevent the orifice from fully closing and causing a scar. We now have intense pulse light that can help us with this, but it is more uncomfortable. Most insurances don't cover it. But what intense pulse light does, as we've talked about before, is decrease inflammation. It liquefies the oil in the meibomian gland. It dilates the orifice of the meibomian gland. It kills any mites and bacteria on the orifice, and it improves collagen structure of the underlying tissue. So those 5 things together really do help sometimes open up the stye and prevent it from becoming a chalazion. A chalazion is a scarred gland or scarred meibomian gland that was a stye and now is becoming more of a chronic condition. The key thing is if we can get to patients within 30 days of their stye, we have a very high success rate of opening up the stye with just intense pulse light. Sometimes it can be, we think obviously the sooner the better. Sometimes we've had success with patients that come in even after that 30-day point, but it can take more intense pulse lights to have that stye open up without surgery. So the key ways we've talked about before in our stye podcast to get rid of a stye: warm compresses, excision, which is the gold standard. You just slice it open with surgery, about a 10-minute procedure. It's a little painful, covered by insurance, but we don't try not to do that because we want to save the gland. So now we have intense pulse light, and of course steroids. Steroids have always been a procedure that's been used for styes, but we don't like to use steroids because of the rare risk of leaving you with a white line on your eyelid, which can be permanent sometimes. It goes away in most patients, but it can be permanent, and loss of vision. Those are the risks of steroid injections. Really rare, but can happen. So we prefer to avoid steroids if we can, whenever possible. Okay, so let's show you the video. So on YouTube, we're going to post the video of what a patient that just recently came in with a sty. It started about 2 weeks ago, came in. He was already scheduled for an intense pulse light procedure because he has multiple styes. He has multiple styes because he has rosacea. And rosacea is that genetic condition that increases your risk of inflammation. And it is the gene, we think, associated with a European ancestry. So as we go through, this is after the IPL, we're expressing the oil, and you can see at these little dots here, you can see one kind of, another sty was starting to form, and you can see this kind of, this is not where the main sty was, but you can see how there was a sty probably forming there that's finally opening up, and we're going to go across to the main sty in just a few minutes. But each one of these little kind of white dots here is the orifice of the meibomian gland, and now we're pushing out the oil. The oil should look like olive oil and not thick toothpaste. And so as we go across, you can see where the real sty is. He actually has 2 of them. And so we're pushing on the gland, trying to get that to open up. And you'll see here, we keep going. Sometimes it's very stubborn. So here's the opening of where that gland wants to open up, but very stubborn and just really not wanting to open up. So we're just keep pushing with the heat of the IPL, which has opened the orifice. Okay, so here we go. So we're trying to keep on opening up that sty with the help of a little bit of pressure. I tried to open up with the back of a Q-tip to see if that would open up. And then with just a lot of prodding and pinching, you can kind of see now it's finally starting to open up. And now you can see the inner contents of the sty. And that's the one that was really starting to hurt because of the pressure in the meibomian gland. So now the orifice is fully open. This will continue to produce a lot of its contents, but we want to keep the orifice open with warm compresses. We will give some ointment of steroid and then continue the just expression. So this stays open. So that's pretty much what the expression of a sty can look like after an intense pulse light. We've now used this on over 100 patients with very good success, but it really depends on the timing. If patients come in after that 30-day period, it may not work. We can prevent further styes, and that's what intense pulse light is good for, but obviously we prefer not to do surgery if we don't need to, so this is a quick way to kind of help with that. I hope this was helpful. If you have any questions, please connect with us at Visionary Eye Doctors. Thank you, and please don't forget to subscribe. Thank you.